Bill, how many people are on the line right now?
Check that. I've got too many things open.
Phil, can you confirm that everything's ready to go?
We are ready to go.
Okay. All right. Well, so good morning and welcome everyone. Welcome to the Survival Coalition of Wisconsin Disability Organizations press event to hear how the state's most vulnerable people with disabilities and older adults are coping during the COVID-19 crisis. I'm going to start with a few housekeeping details. They are on your screen, but just clarifying that if folks need interpretation or want interpretation services, there are directions for the ASL interpreter on your screen. You need to pin the interpreter to your screen in order to see them throughout the event. So look for the participant named Jenny Buchner, and then click on the three dots in the upper right-hand corner of Jenny's video screen, and then you have to click Pin Video. You will now see Jenny even when another person is speaking. Unfortunately, Zoom does not allow you to pin more than one person at a time, so you will not be able to pin both the speaker and the interpreter. All attendees will be on mute throughout the press conference today. Questions should be typed into the chat box. After our speakers are done sharing their stories, we will go to the chat box to answer any questions. As I mentioned before, we will be recording this press event today, and we'll make the recording and all of our related materials available after this event. So to get started, my name is Lisa Pugh, and I am a co-chair of the Survival Coalition of Wisconsin Disability Organizations, along with executive director of the ARC Wisconsin. I will be moderating this press event along with my fellow co-chairs, Beth Sweden and Kirsten Stein. The Survival Coalition is comprised of more than 30 statewide disability organizations that advocate for and support policies and practices that lead to the full inclusion of people with disabilities and their full participation and contribution. Recording and all. We are hosting this event today because people with disabilities, older adults, and those with chronic conditions are noted by the CDC as being incredibly vulnerable to COVID-19. According to estimates in Wisconsin, more than 1.5 million, or 36.5% of adults over the age of 18 are considered at high risk of serious illness, if infected by COVID-19. These people are also especially vulnerable for other reasons. They rely on outside care professionals for their daily supports, often dozens of people that are coming in and out of their homes, providing cares for bathing, dressing, and for meals. Social distancing for these folks is literally impossible. The workers that they rely upon are in great demand. They have folks have a hard time finding workers. These workers make extremely low wages, and they often don't have health insurance. So you can imagine that these workers are putting their own health and their family's health at risk when they're traveling from home to provide cares. They often are doing this without the benefit of protective equipment or PPE that we've heard a lot about. Finally, many people with disabilities and older adults live or receive services in what are called congregate settings or group homes, nursing homes. These are extremely high-risk places. To date, nearly 10% of Wisconsin COVID-19 cases have occurred in these types of group facilities or group housing. The Survival Coalition has been hearing from these people, and that's why we're talking with you today. In Wisconsin, more than 85,000 people rely on in-home personal care, home health, and many other services to help them stay in their homes. Like all of us, they are concerned and isolated in this crisis, but they have other very significant concerns that you're going to hear about today. They are anxious both about today and about the future. The long-term services and support system that they rely upon for their daily lives is really strained right now to meet their needs. In today's press event, you will hear from individuals from all corners of the state, folks from Watertown, Eau Claire, Oshkosh, Nakusha. We will also be sharing highlights of a statewide survey. We heard from 80% of Wisconsin's counties and more than 500 people. I will start now by first introducing Christie Newman from Watertown. Christie uses a wheelchair. She requires daily personal cares from providers who cannot access personal protective equipment or PPE, even though Christie has some significant respiratory issues that put her at high risk for COVID-19. She has also been forced to move home with her family, and she's lost her job. Christie, thank you for sharing your story today.
Thank you. My name is Christie Newman. I'm from Watertown. I was born with spina bifida, so that limits my mobility. And I also have respiratory issues. My concerns are pertaining to my health. About 2 years ago, I was placed in the hospital for other issues due to my spina bifida and found out that I have pulmonary hypertension, which is fluid around the heart and the lungs. I was immediately placed on a ventilator and oxygen, and even though the usage has decreased, I'm still currently using it, and that worries me with this COVID-19 pandemic. Also, my caregivers are in short supply, and they have been on the 14-day quarantine, which makes the supply even shorter. Their supplies are also unshort. And while they do glove up, they often do not wear masks or gowns, and they also go to other clients. So I don't know what they're being exposed to, and in turn, what I'm being exposed to. But my biggest issue is the self-isolation. I've gone from having 3 different jobs to doing nothing. The only people I see are my caregivers and my mom. So it gets really lonely. And yeah, so we need to just be aware that even after this pandemic, reach out, make sure that everyone is okay. Because during this pandemic, even people without disabilities are feeling depressed, lonely. And for people with disabilities, that is often a normal feeling, whether there's a pandemic or not. So make sure to reach out and check on everybody, because we are all in this together. In conclusion, I would like to thank you for letting me speak on this very important topic. I would also welcome any kind of funding that the new relief package could offer to people like myself. Thank you for considering our needs as you work on this proposal.
Thanks so much. Thanks so much, Christy, for your story. We really appreciate it. Good morning. My name is Beth Sweden, and I am also co-chair of the Survival Coalition. I'm the executive director for the Wisconsin Board for People with Developmental Disabilities. And I do see we're starting to get a question or two in the chat box, and I just want to mention that we'll take all the questions at the end of the press event. So as things emerge, please feel free to record them in the chat box, and then we'll get back to you. So thanks so much. As you could tell from Christy's story and the stories you're going to hear in a few minutes, there's been some huge disruptions to people's lives if they're living with disability, and also for older adults. They're losing the workers that allow them to stay in their homes and stay safe and healthy. They're also losing their connection to employment, their connection to transportation so that they can get safely to medical appointments and out in the community. And we are increasingly also hearing from the providers who support them that with no extra state or federal funds, that they are in jeopardy of becoming either losing their workforce permanently or even financially having to fold. And that's going to affect all counties in the state. So we're really concerned about people with disabilities, but also around the whole networks of supports that's so fragile in our state and that is in jeopardy right now. So to talk a little bit more about some of the issues with the workforce, but also with the connection to health and safety is Jason Endress. He and his wife, Julie, live up in the Eau Claire area, and they are both dependent on a support network to keep them safe and healthy in their homes. So thanks, Jason, for joining us today.
Good morning, thank you. Before Governor Evers put the Safer at Home order in Wisconsin, our care providers had started to indicate they wanted to limit their time helping us, and for their safety and their families. We were okay with that because we saw COVID-19 grow faster in states like New York and California. But once the Safer at Home order went into effect, our workers have not come to our home for fear they would be infected or could infect us with COVID-19. So here we are, 6 weeks into the Safer at Home. We have not had any supportive care to help us clean our home. We are trying our best, but it is difficult. We can't get any personal care to help with showering and help us get dressed. We are afraid we can't keep up with the hygiene to the CDC's standard and may be infected, all because our workers can't help us. we place orders to get groceries to find out either items we need are out of stock or we can't pick up our groceries for almost a week because there are no time slots open. This is the only time we go out of our neighborhood as we try to do our part to keep ourselves and others from getting COVID-19. We are fortunate that we are able to get by with little to no help for now, as COVID-19 is projected to at least last much longer. We could be in a world of hurt. We are asking for action from our elected officials. Please don't forget people with disabilities that live in the community. Help us protect our workers with proper PPE we can't get. Help us make our workers feel they can come into our home and be protected, and help us with the things we need to live healthy lives during this pandemic. Thank you.
Thank you, Jason. I'm Kirsten Stein, co-chair of Survival Coalition and advocacy director for Disability Rights Wisconsin. It's important to note that the people who did take the survey for Survival Coalition represent those who have internet access, and more likely they have family members who can support them. There are many folks who had to move in with their family, and this put a lot of stress on the older parents who have now the duty to take care of them with round-the-clock care. And many, many more people across the state live alone and do not have anyone to reach out to for help. In addition, there's great anxiety, not just about losing services. 40% of the people responded worry that if they get COVID-19 and are hospitalized, they might not meet hospital triage criteria and may not get a ventilator because of age or disability. As you've already heard, people are concerned about access to PPE or personal protective equipment. Because the community or home health care workers are not considered frontline healthcare providers in this emergency, they have extremely limited access to PPE, and in many cases cannot even find gloves. We're now joined by Stacy Ellingen from Oshkosh, who has had to move to Fond du Lac back in with her family because she lost all of her care workers. Stacy?
Stacy, you will have to mute yourself or unmute yourself.
Nearly 10 years, but I'm currently at my parents' house in Fond du Lac due to the virus. Like everyone else, COVID has affected me in many ways. The biggest way being I have to stay at my parents'. Due to my physical limitations, I need assistance with all of my basic needs such as toileting, showering, dressing, and feeding. I hire my own caregivers through the ARIS program. Most of my workers are students at UW-Oshkosh, so when the colleges canceled in-person classes for the rest of the semester, my workers went home. I had no choice but to go to my parents. When I am finally able to return to my apartment, personally, I have plenty of gloves for my staff, but I can't get enough masks. It's a huge struggle to find and keep people under normal circumstances. But now, I'm worried it's going to be even harder for me to find and keep workers because they won't feel safe and protected. While I know I'm very fortunate that I'm able to go to my parents and they can take care of me, it's a less than ideal situation. The biggest challenge being I don't have access to the technology I use to run my own business. I have a large large computer set up in my apartment with things such as an enlarged keyboard and an eye gaze system that allows me to access my computer. I don't have that at my parents' house, so I'm not able to get much work done during this. I find it kind of ironic. While most people are adjusting to working from home, I work from home all the time. However, during this outbreak, I'm not able to. It's a unique situation. For me, not being able to work hasn't really affected me financially, but I enjoy working and it gives me a purpose. It's good for my mental health. Not being able to do much work has led to boredom and some anxiety. Another thing that is different living at my parents' is that I'm on their schedule. For example, when I'm at my place in Oshkosh, I stay up much later than they do, but since I'm at their house and I need physical assistance getting into bed, I have to go to bed when they do. I know that sounds very minor, and it is, but it just gives a glimpse into how things are different for me. While my parents are great and help me with all my basic needs, I also find myself reluctant to be too picky or ask for things I want done but aren't a necessity. I look forward to the day when I can get back to my apartment. I'm going to see what the next few weeks bring and go from there. I don't know if things will ever be like they were before, but I find hope that things are slowly improving.
Thank you so much, Stacy, for sharing your story. This crisis is also impacting children with disabilities and their families. Families are oftentimes trying to balance coordinating virtual services from their schools for their children, while also managing personal cares for their children 24/7 in a way that they haven't had to before. They may also be attempting to continue to work from home at their own jobs at the same time. Gladys Walker from Nakusa joins us now to share the story of her family, particular concern about lack of COVID-19 testing that put her family at risk. Gladys, thank you for joining us this morning.
Hello. The biggest thing with us is probably not having school. That's where my son, he goes to a school in a different district, and they have occupational therapy there and behavioral therapy. It's not an ABA school, it's just a regular public charter school. And we have seen an increase in behavioral problems with him. They send us packets to work with him, but I mean, we're not occupational therapists. We don't know if we're doing it right. So we've been just winging it. The biggest thing with the COVID happening was when my son got sick, and he was sick for about 3 weeks, and he was not allowed to go into any medical facility at all. When we would call in to try to make an appointment, they would ask us what his symptoms were. We'd tell him, he's coughing, he's lethargic. His temperature was the highest it got was 107 degrees, and they told us that we could not bring him in because they didn't want him to be exposed to anyone else. And soon after, everybody else in the house got sick, and we were also denied medical treatment. They said that they were not going to test us. We were not allowed to go anywhere, just to stay home. For about 2.5 weeks, we battled with his fever between 102 and 107. And it was constant, off and on. And it was bad. And we're just glad at the time that he didn't have school, because then he would have been missing a lot of school. And being with autism, he misses enough school to begin with. Oh, you're okay. You're okay. You have to wait. I know. You have to wait. And he has a lot of anger problems. They're not. Yeah, I'm talking about you. They're not as bad as, you know, some of my friends that I've met with children with autism, but they are frustrating. And with him being out of school, it's hard for him to manage. Because, you know, he's got all these support people. And with COVID going on, we can't even get anybody to come in to, you know, help us with that. But yeah, we're outside right now and we're trying to set up a trampoline, and he's pretty frustrated that he can't get on it. It's one of the things that we had noticed inside of his care package was to keep him busy. So we got him a saucer swing, and he likes that. That calms him down, and we just got this yesterday. I was told that we could get this paid through the state, but there's nobody really in office to help us with it. His worker with the children's long-term care waiver, his caseworker is really, really helpful to us right now. And also Dr. Funmaker with the Ho Chunk Nation helps us a lot. But since, you know, the COVID, it's kind of, you know, we can only get through to them through email, which is fine. But what we're really missing is the occupational therapy that he's been getting at school. And a lot of the paperwork, like I said, a lot of the paperwork that they give us is, we don't know if we're doing it correctly. But yeah.
Well, Gladys, thank you so much for sharing your story. We really appreciate it. And thanks to your son for being so patient there when there's so many other things that I'm sure he wants your attention for. So yeah. Thank you so much. I just wanted to summarize.
Yeah, I can't hear you.
Sorry, everyone. I thought I was unmuted, but I'm not. Gladys, I just wanted to thank you so much for your story. Really appreciate it, and appreciate your son being so patient there. I know he wanted your attention to get things done, so thanks so much. Appreciate that. And just want to underscore again what we heard from the folks today, but also from our survey results, are that, as you can see, people's lives have really been disrupted, and they're facing a lot of isolation and unsureness, really uncertainty about how to do things, how to get things done. The support networks that typically keep people in their homes and keep them safe and healthy have eroded. That the folks who are on the front lines doing the work don't have the proper gear, and so that leads to heightened anxiety and really reluctance to go out into people's homes. And of course, the folks involved with their increased risk of contracting the virus are worried about anyone that they do have contact with. So those support people without the right supports are really leading people to be hesitant to accept services. And even if they can get those workers, again, those workers need to be safe and protected with the proper gear. You also heard today that families are picking up the slack here, and oftentimes those are families who are aging family members as adults have to move back into the original homes. So lots going on right now. The survey kind of underscores some of those heightened concerns, and without the proper amounts of support and funding, people are really in jeopardy here of some pretty catastrophic health concerns. So that's kind of the summary. And we can get you we have some press materials that we will send out afterwards with more details. I know that we do have some questions, so want to go to those questions right away, if that's all right. The first one is a question for Christie, or for really anybody who's experiencing that lack of personal protective equipment. Do any of you feel like if the equipment was available, that it would be easier to have workers come to your house? Would you feel more willing to accept them and into the home? And then also, would you find people who are more willing to do the support?
Yes, definitely.
That's from Christie. Looks like Stacy's nodding her head as well. Is that true, Stacy? Or maybe not sure. Yeah.
Yeah, this is Jason.
Christie, do you? Oh, go ahead, Jason.
I certainly would agree with you, Beth, that if we did have proper PPE, that I could convince my workers that they would be safe.
Thanks. There's another question here. State health officials are saying that they're trying to encourage health providers to seek tests for a broader group of people now because of the expanded capacity. Is that message not getting through to local healthcare providers? Are any of you experiencing a broader group of people getting access to tests? Any knowledge on that? Do any of you have care workers who've had tests, or anyone in your network who's been able to be tested? It sounded like Gladys was not able to be tested when her family fell ill.
No, I think, well, in the beginning, I think it was more of a fear that, you know, they've seen how fast it can travel, and they've seen how, you know, sick people got, that even if they did have testing, they didn't want to expose any of their healthcare workers to it. And that's understandable, but at the same time, when you have a 5-year-old who's nonverbal, it was very frustrating and it was very hard. And one of the things was, I think a lot of the numbers are not fully. I think in Wood County they tested 1,200, but the people who were actually sick were a lot more than that. And we weren't the only ones that were denied. A lot of people were denied. A lot of people with, you know, minor fevers weren't allowed to go to the doctor. A lot of people who, you know, were seriously sick weren't allowed to go to the doctor. And I honestly think that it had something to do with people being overly scared about it. And I really hope that now that people are taking these, you know, the measures that they have been taken for COVID, that we can get a lot more people tested. Like I said, it took him 3 weeks to recover from his sickness. It took me about 2 weeks, my daughter about 2 weeks, and my husband about 2 weeks. So all 4 of us were sick eventually within the entire month of March and early April. And we're all pretty healthy. I have rheumatoid arthritis and lupus, but I'm not on any medications. I am currently in remission. And so that was in the back of my head, like, what if I do get sick? What if it does, you know, aggravate my symptoms? But at the same time, I was more worried about my children and my husband than I was more about myself. And it was like, if I got it, then I got it. But, you know, as long as these guys are okay first, then that's the only thing that mattered.
Beth, if I may step in and speak more broadly for Survival Coalition, I think our coalition members are extremely concerned about both the access to testing and protective equipment, because that's what's going to help them to assure both the people that they want to hire and keep to be able to go into people's homes, like Christy, like Jason, like Stacy, to provide care, that both those individuals are safe and have the protection that they require to continue providing care, and that also that we're able to keep people with disabilities and older adults in their homes safe and protected. So I think until there's broader access in the home healthcare workforce to both the PPE and testing, we're going to continue to have some really significant concerns.
And if I could add to that, testing, even accurate testing, is only a snapshot. It only tells you what a person is today, if they're positive or negative, which is why PPE is so important for individuals with disabilities who have underlying other health conditions that make them particularly vulnerable. They need to see their care workers every day, and it's not likely that there's going to be a test that's rapid and available every day. So there still needs to be that prophylactic protection of the PPE to help people get the care in their home that they need.
We have a question about.
None of my workers were officially tested. I had 2 workers that just went, oh, we're not feeling well. We're going to go on a 14-day isolation.
We have a question in the chat box about the methodology of the survey. I'm not exactly sure what the specifics are, but we can tell you that it was a SurveyMonkey link that was sent out with a series of questions statewide to our network. It distributed that way and then collected. So it had a series of questions about what people are experiencing and then what their greatest concerns are. So that was the survey. Lisa, Kit, do you want to add to that at all?
Just that we paid attention to ensuring that we had geographic representation from the state. As I mentioned, there were approximately 80% that we heard from about 80% of counties. And then also in the information that's provided after this, you can see some of the breakdown of people with disabilities, older adults, and people who are participating in different programs. So we wanted to make sure that we were seeing a general slice from across the state. I would say this is, like Beth said, a SurveyMonkey. It's not a scientific methodology. It was really just to be able to get kind of a temperature of what was happening in Wisconsin.
Mm-hmm. And as Kit had mentioned, oh, go ahead, Kit.
We specifically asked providers not to complete the survey because we wanted to keep it focused on the individuals who are receiving the care and have the disability. So I think that it was provided a lot of insight to individual stories. I don't know that we can say that we have a representative sample for the percentages, but it is clearly, if there's a lot of people out there talking about it, it's something worth listening to.
Just as Kit had underscored earlier too, we want to remind people that with the survey, the only folks who really were able to take it were people who are connected to the internet, because that was the methodology. We didn't do any paper and pencil versions, and we do know that our community is less likely to have a smartphone or a tablet or a computer, and also less likely to have Wi-Fi in their homes. So we know that this was not a complete snapshot, and we do continue to be concerned about those most isolated people in our community who don't have both don't have family members, but also don't have any kind of connection at a time when everything has become so virtual, including this press event. So continue to have those concerns. Christie, we have a reporter's question specific to you. Can you talk a little bit about what your greatest or biggest challenges are right now, and the feelings that you're having about the day-to-day disruptions in your life?
My biggest obstacles right now are just getting care. Yeah, there's, like I say, there's caregivers that won't come in because they're not feeling well and they won't get officially tested, but they go on a 14-day quarantine. My biggest fears is, what if I get exposed?
Yeah, we're hearing that a lot for sure.
And I think on the other part of the earlier part of the question, as to who Survival Coalition is trying to reach with this, I think it's just a general outreach to the community, including legislators and policymakers, to not forget about people with disabilities. Everybody's inconvenienced with COVID crisis. Everybody has disruptions in their life, but for people with disabilities who often have underlying conditions that rely on personal care workers or live in congregate settings, the problems, the likelihood of infection, the concerns and the ability to maintain their lives is added a whole nother level of complexity and problems to what's going on for them. And this group can sometimes tend to be marginalized as they focus on the main group getting back to work, and that's important. But it's really, these people can't be forgotten. They really need to be brought into the mainstream of things that we're thinking about and what we're caring about and going forward with improvements and bringing things back as we hope to do.
All right, I'm not seeing any more questions. So we do have a summary of the survey and a little bit more information that we'll be sending out after the event. And if any reporters want to connect with our speakers today, please contact one of us and we can get you connected directly to those folks as well. But thank you so much to our speakers. We so appreciate you taking your time today. I know you're all busy with other things and have other things you're juggling, but appreciate the sharing of your stories and for your time this morning. And thanks to the media who came on as well. And we're happy to continue offline with any other additional information that you need. So thank you so much.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.